دلوقتي هنستمر برضه في الماسكوسكليتال، وعاوزين شوية همة كده الله يهديكم عشان ننجز يعني في الموضوع دوت بإذن الله تعالى. يلا أوامك أوام بقى. And this is the X-ray of the distal part of the leg and ankle joint. وفي lesion in the distal part of the tibia. ركز معايا. يطلع الليجن دوت. Okay, and this is nanospine fibroma أو fibrous cortical bone defect. هما الاتنين قريب زي ما قلنا قبل كده. The lesion is cortical with sclerosis and some bone expansion. لكن the cortex is intact, مفيش fractures, مفيش بالosseous reaction, مفيش extraosseous and soft tissue component. And this is the X-ray of the right shoulder showing
in the upper chest and within the right humerus with flattening of the humeral epiphysis and expansion of the humeral metaphysis, soft tissue density, the projection of the synovium. So the patient is 43 years, presented with swelling of the right shoulder blade.
Yeah.
And there is secondary degenerative changes within the joint. So
Okay. أنت قلت إن في abnormalities in the chest، وقلت إن في flattening of the humeral head، وفي irregularity of the head of the humerus as well as the glenoid part of the scapula with some soft tissue swelling around the shoulder joint. Then what do you think? Yes, this is right, and this is the TB of the shoulder joint. طبعا كون إن في changes on either side of the articulation ده معناها إن this is articular disease وليس bone disease. ففي erosions أو changes in the glenoid, erosions of the head of the humerus, and there is evidence of pulmonary tuberculosis, and this is TB of the shoulder with ليه اسم في الليترشر كده اسمه كيرس سكة، وحتى من غير إن في حاجتين في الإكس راي مهمين جدا في الامتحان، إن ودي واحدة منهم إن الشولدر بيجي معاه جزء من الشيست، وغالبا الديزيز بيكون في الشيست مش في الشولدر. والحالة التانية اللي هو بيكون في lesion in the kidney و lesion in the spine. يعني الكدني والسباين غالبا بيكون هما الاتنين تي بي، وانت بتعرف التي بي اللي في الكدني من التي بي اللي في السباين اللي جنبه. هما دولت حالتين مشهورين قوي في الكلينيكال براكتس. This is axial MRI T2 weighted image of the leg. Yes, and there is an expanding lesion with multiple fluid levels in the tibia, diagnostic of aneurysmal bone cyst. Yes, and this is X-ray and CT of the distal part of the femur. And there is a sclerotic lesion in the distal part of the femur with sun-ray speculation, extraosseous soft tissue component, and the component is evident in the CT scan, diagnostic of osteosarcoma. مفوشي ولا بولير؟ بولير. Yes, multiple enchondromas of the carpals and phalanges. The metacarpals and phalanges with no soft tissue filimbuli or calcification, and this is multiple enchondromas diagnostic of Ollier disease. This is MRI of the ankle, and this is sagittal, this is axial T1 and axial. نعم. Calcaneonavicular collagen, calcaneonavicular collagen, and الcalcaneus اهو وادي النافيكيولار. تيلو calcanean collagen and التيلس ودي calcaneus. tibialis posterior ماله؟ حلو، tibialis posterior كويس، والفليكسور ديجيتروم فليكسور ارسوس كله كويس، peroneal tendons كويس. This is normal. X-ray of the foot in a diabetic patient. Yes, and this is Charcot joint with destruction of the tarso-metatarsal joints, with irregular joint lines, bone sclerosis, and dislocations or deformities. And this is the Charcot joint. X-ray of the hip and the proximal femur on the right side. Fibrous dysplasia, simple bone cyst. Yes. Fibrous dysplasia is an expanding lesion, ground glass, long lesion in a long bone. البروكسيمال فيمر والبروكسيمال هيومرس محجوزين باسم السمبل بون سيست. Yes. MRI of the left shoulder. مين؟ superior. سمعت كلمة superior. chronic tear of the supraspinatus. Yes, there is acromion down slope with narrowing of the space between the acromion and the humeral head. This is the supraspinatus tendon, which is the seat of full thickness tear and a significant retraction, with the muscle bulk is still maintained. This is full thickness tear of the supraspinatus tendon. MRI of the hip joints, T1 and this tear. Transient osteoporosis. There is bone marrow edema of the femoral head and the neck, with the bright signal in the T2 and some joint effusion. And this is a diagnostic of regional osteoporosis. Regional osteoporosis will appear, will show no abnormality in the plain X-ray, but it will show significant uptake on bone scan. And on MRI, it will display bone marrow edema in the form of low signal in the T1 and high signal in the stair, affecting the femoral head and the neck, associated with joint effusion. MRI of the wrist. Hamid Malu. Low signal of the hamid. التشخيص avascular necrosis. And this is fracture of the hook of the hamate. You can see the fracture line, and the fracture is surrounded by bone marrow edema, which will appear of low signal in the T1 and high signal in the T2. And fracture of the hook of the hamate is one of the causes of the carpal tunnel syndrome. It may increase the pressure inside the carpal tunnel and result in abnormalities in the median nerve. طبعا في البلين اكس راي بتعرف الهوك اوف ميد فراكشر من علامة جبارة جدا. عارفينها؟ عارفينها؟ مش عارفينها؟ طيب في حاجة اسمها the eye of hamate، ديت الهامات وديت العين بتاعتها. whenever you lose the eye of hamate تعرف إن الهوك بتاعتها مكسورة. دي واحدة من الساينز القوية جدا في البلين اكس راي. Whenever you are not able to identify the eye of a hamate, then you know that the hook of the hamate is fractured. Okay. X-ray of the right shoulder. Now, aneurysmal bone cyst. And this is the sign اللي أنا قلت لك عليه قبل كده، the finger in a balloon. إنك أنت بتلاقي البون ماشي كويس، مرة واحدة بقى منتفش كده اهوت. And this is a bubbly lesion. And this is not going for a simple bone cyst. Then this is aneurysmal bone cyst. ودوت الفينجر in a balloon اللي هو العظمية ماشي كويس وبعد كده اتنفش زي ما انت شايف كده. Okay. This is X-ray of the right hip, and this is CT of the hip joint. What do you think? نعم؟ حد قال حاجة؟ شمال يمين؟ يمين. هو قال osteoma of the ischial tuberosity. لكن you do not see actually the manifestations of osteoma, and all what you see is that the obturator internus muscle is swollen and there is soft tissue swelling outside the ischial tuberosity, and this is of course the continuation of the obturator internus muscle. And you got some bone sclerosis within the posterior part of the acetabulum, which is not evident here, but by MRI we can see that there is an infiltrative lesion involving the acetabular area as well as the ischium, which is a low signal in the T1 and high signal in the T2 weighted image. إن زي ما انتوا عارفين في يعني قاعدة كده أنا عاملها اللي هي whenever you see an infiltrative lesion أو destructive lesion in the pelvis، لو كان طفل تفكر في Ewing sarcoma، لو كان adult تفكر في metastasis. And this is an adult patient where you see an infiltrative lesion in the iliac bone and you think of metastasis, and you know that lymphoma the secondary lymphoma طبعا هي بتبقى metastatic يعني جاية من أي حتة تانية. Then you consider metastasis and lymphoma من الحاجات اللي بتحصل في الإيلياك بون بتاعة الأدلت. أما في الطفل فالإيوينج أشهر واحد. This is MRI of the spine, the lumbar spine, T2 weighted image. في إيه؟ multiple lesions in L4, L3, and L1. Yes, and there is bulging and convexity of the posterior border of the vertebrae. Lymphoma, multiple myeloma, and metastasis. This is bone scan, which is free.
Then let's exclude.
Yeah.
It's multiple myeloma.
Yes, and this is multiple myeloma. في ساين في الكتب بتقول لما يكون الفرتبرال بودي البوستيريور بوردر بتاعه كونفكس كده encroaching on the spine, then you think better of myeloma أكثر منه في الميتاستاسيس. لكن in many cases we are not able to differentiate metastatic deposits from multiple myeloma based on MRI لوحده. لكن طبعا في غياب الابتيك في البون سكان دوت بيحبذ قوي موضوع الميلوما. An X-ray of the knee. lateral view showing multiple loose bodies in the posterior part of the knee. This is MRI T1 proton density and T2 تشخيص synovial osteochondromatosis. This is MRI of the ankle showing
How to differentiate the biggest case from Baker's
it is Baker's cyst containing synovial osteochondromatosis. يعني البيكر cyst is a synovial recess continuous with the joint. ممكن يحصل فيه كل اللي بيحصل في الجوينت نفسه. يعني يطلع فيه ساركوما ويطلع فيه لوز بودز يطلع فيه كل حاجة. Now, swollen Achilles tendon with almost maintained the normal signal intensity, and this is diagnostic of Achilles tendinopathy. This is the normal appearance, the normal thickness of the Achilles tendon. Okay, and this is MRI of the shoulder, sagittal image, and an axial image.
Adhesive capsulitis because the thickening of the inferior humeral ligament.
مش باين أصلا الانفير ligament. Yes. Yes, and there is tear of the posterior labrum compared to the anterior labrum, which is intact. And this is the middle glenohumeral ligament, and this is the subscapularis tendon without the infraspinatus tendon. The posterior labrum is torn, and this is known as the reverse Bankert lesion. Okay. X-ray of the pelvis in a 12 years old male. ABC, شمال يمين. Yes, and there is an expanding lesion in the iliac bone and the pubic bone with bubbly appearance, and this is highly impressive of an aneurysmal bone cyst. MRI of the shoulder. Supraspinatus tear, complete or partial. Articular or version? Articular surface tear. There is osteoarthritis of the acromioclavicular joint, and there is tear within the supraspinatus tendon in disrupting the inferior surface towards the articular aspect of the joint, and this is articular surface partial tear of the supraspinatus tendon. Yes. MRI of the shoulder, axial, and the corona. Yes, this is the subscapularis tendon tear. You see, the subscapularis tendon is not reaching the lesser tuberosity. This is the bicipital groove, and this is the biceps tendon in the groove, anterior labrum, posterior labrum, and this is the normal appearance of the subscapularis tendon compared to this intact tendon, and this is the disrupted tendon. And you know there is a distance between the coracoid and the head of the humerus. This distance should not be less than 8 millimeter. If the distance is less, and this is known as coracohumeral impingement. coracohumeral impingement. واللي بيمر في الحتة ديت ما بين الكوراكويد والهيد اوف ذا هيومرس هو السبسكابيلاريس. في حالات الامبنجمنت ممكن يتقطع ويكون الديستنس دهيت أقل من 8 مللي. X-ray of the abdomen of the gallbladder. أي حاجة. There is extensive soft tissue calcification in the right hypochondrium. ولو كنت في الجي اي تي، لكن انت في الماسكولار كنت دلوقتي. Yes, and if you look carefully to the rib and you see that there is a part of the rib is missing together with a big soft tissue mass with matrix calcification, and this is chondrosarcoma. Okay. MRI of the shoulder, axial image, heel sac and blanket. There is disruption of the anterior labrum compared to the posterior one. There is a groove defect in the posterolateral aspect of the humeral head, and there is also joint effusion, and the effusion is surrounding the biceps tendon in the groove. Yes, axial images of the ankle. There are multiple loose bodies in the anterior and posterior compartments of the joint, diagnostic of synovial osteochondromatosis. MRI of the knee, ABC, ABC, GCT, joint cell tumor, yes, and this is an expanding lesion reaching the articular surface, low signal in the T1 intermediate, and proton density and high in the STIR image, and this is joint cell tumor. Advanced rheumatoid arthritis X-ray hand showed marked destructive changes in the metacarpophalangeal joints and also the interphalangeal, with severe bony changes in the intercarpal joints, which are almost totally enclosed, with marked narrowing of the wrist joint. And you can see here some of the joint replacements بالإيديتانيوم. Okay, advanced rheumatoid arthritis. X-ray frontal view of the left hip joint. In a 16 years old male patient. What do you think?
Small metaphyseal lucency.
A small metaphyseal lucency. Good. very, very good osteoposture. الايه؟ ماله؟ Acetabulum is irregular. This is the CT scan of the same case. Soft tissue swelling off. مين؟ نعم استنى. Obturator internus. Yes, obturator internus muscle is swollen compared to the opposite side, and the iliac bone is not sclerotic. هي كايز تكون باين هنا ان هي sclerotic, and this is sarcoma of the iliac bone. And this is the scaphoid showing almost diffuse bone marrow edema. There is no fractures, and this male patient with obesity is landing and developed soreness over the radial aspect of the wrist joint. The radiographs were normal. This is just bone marrow edema, which is one of the sequelae of trauma. You get bone marrow edema of the bone without evident fractures or طبعا هنا ما فيش avascular necrosis لما بيحصل في البروكسيمال بون، لكن this area is not edematous بس، لكن الباقي كله في diffuse bone marrow edema post traumatic. Lateral X-ray of the ankle. تقريبا ما فيهاش حاجة لأن الكيجر فاليو فاتنز انتاكت الكيلس تندون. نعم. كالكينيو فيلس ماله؟ قصدك هنا يعني osteoarthritis. What do you think about the Taylor dome? Maybe sclerotic then. Okay, this is ultrasound of the Achilles tendon. Yes, and the Achilles tendon is considerably thickened and it is of almost normal echogenicity, and this is Achilles tendonitis. But in cases of Achilles tendonitis, there should be some obliteration of this pre-Achilles fat. Okay. No, yes, and this is adamantinoma, which is there is destruction of the anterior part of the tibia with loss of the cortical outline. التيبيا والمانديبل هما المكانين بس اللي بيطلع فيهم الادامانتينوما، ولما بيكون المنظر كده بيتلخبط في حاجات كتيرة، لكن لما التيبيا تتلوي على نفسها كده ويحصل فيها erosive changes بيبقى سهل قوي انك تشخصه. Yes, X-ray of the skull. Deposits of myeloma is eosinophilic granuloma, Paget hyperbar. Yes, myeloma, and this is the classic appearance of myeloma with vasculitic lesions of almost similar size. الديبوزيتس غالبا بتكون مختلفة في الأحجام، جايز فيها سكلروزس. الزنفيليك جرانيوما تعمل جيوغرافيكال أبيرنس، الباجت مش كده خالص ولا الأيضا. طيب MRI of the knee T1 and axial T2. مين؟ Soft tissue. Soft tissue swelling in the anterior part of the knee. Lymphoma arborizes in this fat, which is bright in the T1 and of relative decreased signal in the T2 with the image. And this is a very illustrative appearance of lymphoma arborizes. You see the anterior knee joint space is distended by fluid, and there is the front-like projections of fat signal intensity in the T1 and T2 with the images. Diagnostic of lymphoma arborizes. MRI of the shoulder, coronal T of the coronal gradient. Soft tissue. Inferior. ماله؟ الليجن في أنهي حتة؟ فوق تحت شمال يمين؟ superior labrum ماله؟ تاني أنهي واحد فيهم؟ يعني رقم 1 ولا 2 ولا 4 ولا 5 ولا إيه؟ And you see the superior labrum, there is a linear abnormal signal within the superior labrum disrupting the labrum into two parts, and this is slab type 3. slab type 3 لما الليبرم تتقسم نصين. slab type 4 لما الخط يمشي في البايسبس تندون. slab type 2 لما البيز بتاعت الليبرم تتفصل من الجلويد مسافة أكتر من 3 مللي. slab type 1 المثلث is intact وجواه abnormal signal دوت slab type 1. and this is type 1 lesions within the intact superior labrum يعني فيها abnormal signal. type 2 separation of the base. type 3 the labrum is divided into two parts. and type 4 the tear extends into the biceps tendon. مين دوت؟ osteochondritis dissecans ولا vascular necrosis of the talus. Yes, هي طبعا بس a vascular necrosis of the talus. This is the coronal reconstructed image of the CT, and this is stage gap. stage كام؟ 1 ولا 2 ولا 3 ولا 4؟ ها؟ ملناش دعوة stable unstable 3 ولا 4 ولا 1 ولا 2؟ 3. الاثنين بيكون النيكروتيك بون is not yet separated from the talus. لما تبقى separated ما اتحركتش من مكانها هيبقى 3، لما تمشي من مكانها هيبقى 4. And this is stage 3. CT of the hip joints. مين؟ Yes, this is septic arthritis of the right hip. There is erosive changes in the femoral head and the neck, some bone sclerosis, and distension of the joint by inflammatory granulation tissue, with affection also of the acetabulum, and this is diagnostic of septic arthritis of the hip joint. X-ray of the ankle. ايه الاخبار؟ Joint fusion. There is soft tissue shadow posterior and anterior to the joint, which is suggestive of effusion. Very good. Lateral view of the shoulder. مين؟
This is not to exclude dislocation, but there is no dislocation.
مفيش dislocation بس في اللي هو الأكروميوم type 3 with anterior hook. This is very prominent hook. This is type 3 and acromion with anterior hook. Type 1 flattened under surface. Type 2 curved. Type 3 anterior hook. Type 4 convex under surface. Yes. Because degeneration of the ACL, there is diffuse swelling with abnormal signal and زيه زي الكرفس كده اللي هو مخطط منه فيه, and this is mycoid degeneration the anterior cruciate ligament. MRI of the elbow. مين اللي فيه المشكلة؟ مين؟ وانت علي صوتك عشان أسمع. المشكلة ناحية الراديوس ولا الناحية التانية؟ ناحية الراديوس. وهي في الراديال كولاترال ولا في التندون الكومن فليكسور تندون ولا ده الاكستنسور الاكستنسور؟ السهم دوت بيشاور على مين؟ على الكومن اكستنسور تندون, وهو فيه abnormal signal اسمه ايه دوت؟ lateral epicondylitis اللي هو جولف ولا تنس؟ Mass and the iliac bone with soft tissue component inside the pelvis and outside the pelvis, and these are the possibilities: deposit, lymphoma, Ewing sarcoma, osteosarcoma, osteomyelitis. Ewing sarcoma. طلعت osteosarcoma. ما تفرقش يعني Ewing والأوستيو قريبين جدا من بعض. Male 58 years old, X-ray of the pelvis showing this mass with calcification. Osteosarcoma of the pubic bone. X-ray of the CT of this. Osteochondritis dissecans unstable fragment. These are the criteria of unstable fragment: large size أكثر من سنتي, fluid at the fragment base, and cystic changes in the donor bone, and enhancement of the separation line by MRI. X-ray of the left shoulder showing this bubbly lesion in the proximal humerus, diagnostic of aneurysmal bone cyst. X-ray of the ankle in a female patient, 19 years old, with 11 months history of painless ankle mass. Fusion. MRI. Pigmented villonodular synovitis. There is low signal lesions within the posterior and anterior aspect of the ankle joint, and this is pigmented villonodular synovitis. This is the classic appearance or the classic site of pigmented villonodular synovitis in the knee. Achilles tendinitis, pre-Achilles bursitis, retro-Achilles inflammation, Haglund syndrome. Diaphyseal achalasia, multiple exostosis. Anatomy, مين التندون دوت؟ tibialis anterior، مين دوت؟ flexor hallucis اهوت، tibialis posterior اهوت، برينيس بريفس ولا لونجس؟ لا طبعا البريفس هي اللي جوه واللونجس هي اللي بره. ده برينيس بريفس دوت لونجس. مين الكرومبا دوت؟ الاكيلس تندون. مين دوت؟ اكستنسور ديجيتورم. طيب السهم ده بيشاور على ايه؟ Tenosynovitis of the extensor digitorum. Fluid signal allowed this is extensor digitorum, extensor hallucis, tibialis anterior, and this is flexor extensor digitorum tenosynovitis. X-ray of the pelvis. Sacral lesion, and you see in the destructive changes in the distal part of the sacrum with an appearance of a soft tissue mass. This is a CT scan showing a mass with internal calcification eroding the sacrum. Chordoma, this is the classic site and appearance of sacral chordoma, midline lesion with some destructive changes and matrix calcification. Anosopine, fibroma, fibrous cortical bone defect, sclerotic lesion with cortical distribution. Knee pain in a 7-year-old girl. There is a lesion in the epiphysis of the tibia, and this is chondroblastoma. The CT scan coronal reformative image showing an osteolytic lesion with a sclerotic margin in the epiphysis, diagnostic of chondroblastoma. Sarcoid. Inchondroma. هايبربارا. يبقى احنا عندنا كذا تشخيص، ساركويد وانكوندروما وهايبربارا. اختار مين فيهم؟ اختار هايبربارا. There is هو مش باين على الشاشة الحقيقة، بس أنا قصادي هنا اللي هو السبر اوستيال ايروسيف changes و resorption of the phalangeal tufts, which are major manifestations of primary hyperparathyroidism. Bone edema of the femoral condyles, regional osteoporosis. Vasculoschlatter. Second fracture, diagnostic of ACL rupture. This is a ship fracture of the lateral tibial condyle, which is pathognomonic of ACL rupture in about 75 to 100% of cases. And this is an expanding lesion in the distal part of the fibula before and after backing, with multiple air fluid levels, diagnostic of aneurysmal bone cyst. CT scan of the knee, coronal and sagittal reformatted images with an osteolytic lesion in the epiphysis crossing the physis to the metaphysis. مفيش ليجن في الابيفيسيس الا الكوندروبلاستوما بس. طب ايه اللي عرفك ان الليجن ده في الابيفيسيس اصلا؟ ان المين بالك اوف ذا ليجن في الابيفيسيس، ولما كبر كروس تو ذا فايسز ودخل في الميتافيسيس. كوندرو ولا اوستيو؟ اوستيو ساركوما.